Thank you so much for inviting us, and we hope we will be able to share to you the best practices that we were be able to embrace in the new normal in early childhood education. May I present to you the Philippine case, which is part of it is my personal experience, and some of it is the holistic approach of our government and our school in the Department of Education. If you can see in my profile, I cannot say at home I'm a nurse. So by profession, I'm also a nurse. And the outbreak of COVID-19, which resulted in various forms of community quarantine, has affected the delivery of early childhood education programs in the Philippines. As we all know, the president of our country, President Rodrigo Roa Duterte, would like people to be more informed, to stay healthy, and to fight COVID-19. That's why he set up the Interagency Task Force, or IATF, that would monitor every now and then what's happening within the locality in terms of our health, our safety. That's why we always say that in order for us to flatten the curve, we have to stay at home. So basing on the word that was given by our speaker from Korea, sanctuary, the home is not the sanctuary of our children. So we are the best teachers right now when it comes to educating our children. So how to help our children cope with the challenges resulting from COVID-19. So we would like to share to you that as parents, or as a healthcare professional, and as a ECE practitioner, we have to really stay calm, because listening to them and offering a reassurance that these things would be fine soon is already a thing for them to be relaxed. They are more they have more time now to stay in the television and the social media. So as parents, we really have to monitor our children that is on social media, on a different platform. That's why they need to be more empowered. And then one of the best practices that we are doing here in the Philippines is, since we are all at home right now, we have enough time to talk with them. So they have the fears, anxieties, and we see to it that they should be, we should listen, and at the same time, there's no interruption of work right now. So every time that our small children, the 0 to 4 years old, ask for what is COVID-19, what will be the effect, how come my classmate's mother died of COVID-19, or how come lots of healthcare professionals, nurses, and doctors die of COVID-19. So we should be very honest and accurate in our explanation, because the brains of our little children is like a sponge. They absorb everything that we say. So we really have to be scientific in everything that we explain to them. So here in the Philippines, how do we stay connected with the school and the community? So there's an online platform, there's an offline platform, and sometimes I even see in the social media that the teachers will go to the school or the community just to give the certificate of graduation of their students. So that's how we are connected with our school to the family. So we also give our children the information about the signs and symptoms of COVID-19, because in order for them to understand this virus, and we are facing the new normal, they should understand what is this virus all about, what's the difference between bacteria, the viruses, and these different diseases that we are encountering right now. And then here in our country, we are very heavy in modeling basic hygiene and healthy lifestyle practices. That's why in the Department of Education, by the time that they will open this August and September, there is this hand washing area wherein the children could do their hand washing before they go inside. And inside the school, they also have this hand washing area, or the bassinet, wherein they could wash their hands. Okay, and then sometimes we should not be complacent if our children are not talking. Maybe you thought that they are just trying to unwind, or they just want a space of themselves, but maybe they are having this mental health illness. Okay, mental health illness now is a very high prevalent rate next to children that they would like to do suicide and everything. So as parents, as ECE provider, we really have to see to it that we ask them, how are you? What are you doing right now? And hope you are enjoying even though you are at home. So um, we should be thankful that our government is very proactive when it comes to the benefits, the beneficiary of our children and the women. Okay, so I would like to share to you the Department of Education plans in opening now the school year by August and September. So amidst the difficulties and challenges posed by the pandemic, the Department of Education is committed to ensure the provision of continued learning programs to children 0 to 4 years old. This will contribute to bringing about normalcy in their education activities while facilitating the learner's development. It is important during this time that young children are provided with positive learning environment. So how do we mean by positive learning environment? As we have seen or shared before that this is now their sanctuary. Your home is their sanctuary. So we have to provide a space for them that if they go there inside that room or inside in that nook, in that space provided for them, it is already time for them to learn. So, what are the following tasks that the government now is undertaken in partnership with our Early Childhood Care Development Council, which is part of the Department of Education? The following tasks undertaken during the preparation period by the time the school would open, private and government. We conduct the usual community mapping to assess the situation in the community prior to the opening of the centers. So when we talk about community mapping, they should be aware that hey, it's August. We prepare for schooling, so the centers will be open. So there is what we call the balik eskwela. So parents and the community go to the school to prepare the facilities, the room to be cleaned up, to be sanitized. Then number two is profiling of the young learners 0 to 4 years old. In this way, we'll able to know what are their fears, anxiety, what is the state of health that they are right now. Because in the Philippines, there are some newborn cases that was already positive of COVID-19. So we don't want that they will be exposed to the school and the community as well. So number three is we have to do the assessment of learner's guide to early education, which may be done through home visit while strictly observing health protocols. So if you can see, there's a lot of PPE or the personal protective equipment, wearing masks. Okay, we go from one area to another just to check if they are doing fine, and but we have to see to it that we observe the safety protocols. And then number four is we conduct consultation and survey on the expectation and perception of the post-COVID. So what are, because here in the Philippines, it's only this June that we are on a general community quarantine. So we are doing a little by little adjusting to the new normal, which is building back better. So when we talk about the building back better, we would like to ensure that the centers are sanitized and have undergone disinfection procedures. Hand washing facilities are available with water and soap. Yes, this is additional cost to everyone for the private and the government school system, but this is the best way to be healthy and to be safe. And then number six is to encourage the implementation by Bayanihan.
2 minutes left.
Yeah, by scheduling the parents to assist adhering strictly to physical distancing, okay, and inventory instructional materials and preparation of learning instruction materials worksheet, okay. So as a parent, as a mother, I would like to share to you my 10 top 10 parenting tips, okay. I have 3 kids right now, okay, age 21, 17, and 10 years old. So this is how we do it. My one-on-one quality time to explore their interests. So my second child would like to wear to model the PPE, and sometimes he would go to donation to the hospitals. And we would like to share to you this learning platform I did with my
5 points. What are the 5 essential PPE
items used by the frontliners. So this one, I'm teaching my youngest child, Stephanie, 10 years old, while she is on the online class on what are the important things you use to protect yourself from the COVID-19, which is the PPE. Okay, next is so she was able to draw here protected and unprotected. Okay, and then we make sure that there is harmony in family at home where we pray together before going to bed. We take turns in praying for kids to express their innermost feeling to God, and we want them to keep calm and manage stress. We ask our kids their fears, anxiety, and their must do to provide themselves with post-COVID. So we would like people to stay at home, but as a nurse, as healthcare professionals, and as government official, I see to it that I am there to assist in every way we could. And my husband, when we went to one indigenous people's community, he was able to paint good paintings. Now it's on sale. That is one way for us to help the community. And there is this live session every evening, keeping the family together during lockdown. So far, this is our share from the Philippine side. Thank you and good day.